Hello, my name is Roger Stoop. I'm an oncologist specialized in brain and spine tumors, leading the Northwestern Medicine brain tumor team. Northwestern Medicine's elite, patient-centered brain tumor program offers the highest quality, compassionate and innovative treatment for patients in Chicagoland, the Midwest and beyond. The caliber of our program is reflected by the top ranking of Northwestern Memorial Hospital for neurosciences and neurosurgery by US News and World Report. Today, members of Northwestern Brain Tumor Team will talk with you about Courtney, a 38-year-old mother.
Courtney's husband brought her to the emergency room after she had a seizure. An MRI revealed a lemon-sized mass in her right brain, and I saw her in the clinic the day after she was discharged from the emergency department. Prior to her appointment, I had reviewed the imaging with our expert neuroradiologists.
Neuroradiology is a subspecialty that focuses on the diagnosis and characterization of abnormalities of the brain and spine using neuroimaging techniques. Dr. Lucas shared Courtney's case with me, and we reviewed her MRI together. Based on her MRI, I suspected a low-grade glioma.
When I met Courtney, I explained the suspected diagnosis and the next steps to be considered. I suggested that she meet with one of our neurosurgeons that day to discuss surgical options. Because our multidisciplinary team is co-located, we just had to go across the hall for Courtney to meet with Dr. Lesniak.
We felt that awake surgery would allow for maximum safe tumor resection while ensuring the surgery would not impact Courtney's functional ability like speech and memory. Courtney did very well in the surgery and left the hospital after only 2 days. The resected tumor tissue was then analyzed in detail by our expert neuropathologist at the Lurie Cancer Center for state-of-the-art tissue and molecular diagnosis, which is important for guiding post-surgical treatment.
The Neuropathology Division at Northwestern Medicine is a world leader in brain tumor diagnosis, including the use of next-generation sequencing. These new technologies allow us to classify tumors more precisely and to understand their genetic makeup, since tumors with certain genetic markers will respond better or worse to different treatments. Pathology is a critical tool in our arsenal against brain cancer.
We at Northwestern are among the very first institutions to offer methylation profiling of tumors on a routine clinical basis. Methylation profiling takes a genetic fingerprint of a tumor and allows it to be distinguished from other kinds of tumors that may have very similar mutations as indicated by next-generation sequencing, but are still unique tumors. It's a next-generation effort towards diagnosing these diseases in a way that cannot be done by any other method.
Days later, with Courtney's full pathology and molecular results, the whole team reviewed her case on one of our 2 weekly brain tumor boards. Various treatment options are considered and discussed before coming up with a personalized recommendation.
We discussed her case at the multi-disciplinary tumor board, and it was decided that she would benefit from radiation therapy. There are several radiation therapy techniques used for the treatment of brain tumors, including regular fractionated external radiation therapy with X-rays or protons, gamma knife radiosurgery, and fractionated stereotactic radiation therapy. The indications for these different treatments are mainly based on the type of brain tumor on pathology and genetic testing.
The consensus recommendation from Tumor Board was to treat Courtney with proton therapy. Proton therapy is an advanced form of radiotherapy that treats tumors with a precise dose of radiotherapy that conforms to the shape of the tumor with the goal of reducing the risk of side effects and damage to surrounding healthy tissues. This treatment is being studied for patients with Courtney's tumor type, so we proposed she enroll in this clinical trial. After a detailed discussion of the trial rationale, she elected to participate and is now receiving proton therapy at the Northwestern Medicine Proton Center, which is the only proton center in Illinois and one of only 29 facilities in the U.S.
Through Courtney's care, I served as the dedicated social worker to her and her family. So much of brain tumor care is dependent on the patient and their caregivers having resources, guidance, and support. In Courtney's case, she elected to join one of Northwestern Medicine's monthly support groups. At Northwestern, we understand how difficult and frightening a brain tumor diagnosis can be for the patient and their family. We are dedicated to being there medically, physically, and emotionally every step of the way.
Ultimately, Courtney has had an incredible response to treatment. She was rapidly diagnosed and treated and is now doing very well and living a high quality of life with her family. All of us at the Northwestern brain tumor community are committed to advancing the understanding, diagnosis, treatment, and prevention of brain and spine tumors. We achieve this through innovation and scientific discovery while providing expert, state-of-the-art and cutting-edge treatment, compassionate care and support to both patients and caregivers.